Hello, it's Dr. Rhonda Johnson. Today is Thursday, February 25th, 2021, and I'm going to be talking about COVID-19 infection in children. And most of what I'm talking about today comes from a report released on February 18th by the American Academy of Pediatrics and the Children's Hospital Association. Well, sadly, more than 3.1 million children now have tested positive for COVID-19. And cases in children represent a total of 13% of all U.S. cases now. Now, over the last 2 weeks, we've been hearing about a decline in overall cases here in the nation, but there was actually a 6% increase in cumulated number of children cases. And there were almost 170,000 new cases in American children in the past 2 weeks. Now, hospitalization and severe disease is rare in children, so the number of children in the hospital represented only between 1 and 3% of all the people hospitalized in the United States for COVID-19. But folks, when it comes to looking at the distribution of who's getting sick and who are dying, unfortunately, the racial disparities in American children fall along the same lines as racial disparities in adults. According to the CDC, Hispanic Latino children between the ages of 5 to 17 years old currently represent 26.9% of all pediatric cases and 25% of all coronavirus deaths in children. Now, for African American children between the ages of 5 to 17, they represent 11% of all the pediatric cases and 16% of pediatric deaths. So we have to really be concerned about COVID-19 in Black and brown children. So one of the important strategies is to continue to educate parents about coronavirus in children. So what are the symptoms of coronavirus disease in children? Well, it can look like adults with fever or chills, cough, runny nose or nasal congestion, sore throat, a new loss of taste, a loss of smell, diarrhea, nausea or vomiting, stomach ache, children feeling tired or complaining that their body aches or their muscles hurt. They may have a headache, they may have poor appetite or decreased interest in feeding, especially in babies under a year of life. And as the disease progresses, children may present with shortness of breath or difficulty breathing. Now, there is a complication of COVID-19 in children, rare, but can be very deadly. At least 2,000 children in the United States have been diagnosed with this rare and extreme immune system response. It's called MISC, which is short for multisystem inflammatory syndrome in children. Now, sadly, 69% of reported cases of MISC have been in children who are Black and Hispanic. Now, what is MISC? Well, it's caused by inflammation in the blood vessels, and it can lead to symptoms that involve the heart, lungs, kidneys, brain, skin, eyes, and gastrointestinal organs. So symptoms can include high fever, abdominal pain, vomiting, diarrhea, neck pain, rash on the hands and the feet in particular, bloodshot eyes, and feeling extra tired. So parents, if your children show signs of COVID-19 or MISC, it's so important that you contact their pediatrician or health care provider or either get them to an emergency room for evaluation. And if your child shows complications of COVID, such as trouble breathing, pain or discomfort in their chest, new onset of confusion or inability to stay awake, or any type of bluish discoloration of their lips or their face, or severe abdominal pain, they need emergency care right away. So, again, as an adults, we're not really sure what the long-term effects of this virus will be on the physical health, as well as the emotional and mental health effects of COVID disease in children. We have to stay vigilant. We have to stay the course, continue to practice all the preventive practices that you have been doing for the past year, parents and caregivers of children, and know that the vaccine trials are occurring in children, and it is expected that children will have a pediatric COVID-19 vaccine, hopefully by the end of the year. This is Dr. Rhonda Johnson. My views are my own. My only attempt is to educate and provide information. For specific medical advice, always consult your own healthcare provider. Stay focused, stay on the course, and as always, have a blessed day.